Senator Greg Tarver is joining us. Senator, thank you for joining us on short notice. Greatly appreciated.
Anytime.
Let's start with, we've got LSU Med, we've got Biomed, we've got the proposed funding from the state, and it's sort of all up in the air. Do you see light at the end of the tunnel, or are they messier than ever?
Well, what is really happening right now, that the state have made a proposal to Biomed, and Biomed have not accepted the proposal that the state have put out. All the rest of the private-public partnerships in Louisiana have accepted the MOU. All but Shreveport have not accepted the MOU. One of the problems that you have, I can understand they probably want more money because they owe everybody. They owe LSU Med School money. They owe the drug company people money. They owe the elevator people money. They owe the trash people money. And they owe the pacemaker people's money. And the problem that we're having up in Shreveport, they're not taking care of their business. They're not taking care of their bills. And if you don't take care of your bills, you can't deliver good health care services to your constituents.
Pardon me, Mr. Greg, I don't want to put words in your mouth, so you can say what you want to say. Should I infer from what you're saying that you think Biomed is out of line, not accepting the state's offer?
They're totally out of line. They're being greedy, number one. All the other children in the hospital is ready to accept. But see, the problem that you have, if you turn around and reward someone for being bad, why should someone in New Orleans or Lafayette or other Lake Charles be good? Because the best thing to do is be bad and you get more money. The problem that you have at this particular time, they are not accepting what the state want to give them like all the rest of them have accepted.
Senator Tarver, what's the alternative to Biomed?
Well, let me tell you something. It is a plan in the making. I'm not going to tell you that I agree with the plan in the making, but you got to have some second choice. I can't say what it is because it's not public right now.
Does it start with a W and a K? Does it start with a W and a K?
No, it doesn't. No. That's not even in the deal or in the plan.
Is it another nonprofit that could step in?
That's right. It's another nonprofit can step in if they do not sign. And I'm going to be honest with you. The people up in Shreveport area are getting second-class medical service from University Health. That's all there's to it.
That's pretty strong.
Let me tell you. Let me tell you something. I've been dealing with this. I was on the board of Confederate Hospital. I've been dealing with LSU ever since I've been into the Senate. And let me tell you, I know LSU have not been perfect when they ran the hospital, okay? But I'm telling you right now, we have serious problems here in Shreveport, and they need to be dealt with. And it's too many relationships, too much politics is in the relationship why the governor have not made the decision. The governor, the deadline was Thursday. The governor gave him 24 more hours. Then the deadline was Friday. Then they send the MOU back, redlined it. They're trying to get a political situation solved in this because it's friends to the governor out there. And what we're trying to do, I don't care who's friends to the governor. I don't care if the governor help his friends. I don't have a problem with that. I just want good medical service for the people.
Mr. Greg, once again, not to put words in your mouth, but it sounds to me like you just wish Biomed would go away.
Well, let me say this to you. Biomed, I don't want Biomed to go away. I want Biomed to do what's right and what's fair and do exactly what they're paid to do and stop using this as a personal football game.
Then let me rephrase the question I just asked, because earlier on you said the people in Shreveport are not, you said they're not getting good health care from LSU Med, right?
Not LSU Med. No, LSU Med is the educational portion.
School, yeah.
From the hospital. Okay.
That's exactly right. What I'm saying to you is that they could do a whole lot better. Let me say this. I go up there for service. I talk to everybody there when I go up there. And let me tell you, they don't have the supplies that they need. I hear doctors complain. I hear people working there complain. Only thing I want, I don't care who delivers the service. I just want good service. And the people deserve good service. But they're not getting the best service right now.
And the
something needs to be
reason,
done about it.
pardon me, in your mind, the reason we're not getting the service we deserve is not necessarily the people at the hospital, the doctors, the nurses, the staff, but Biomed's fault in your mind.
That's right. That's exactly right. The administrators, number one, they don't know what they're doing. It's pretty clear they don't know what they're doing. They're not paying their bills. And let me say this to you. You got to pay your bills when they deal with drugs. You got to pay your bills when it deals with pacemakers. You got to pay your bills when the elevator man come up there and you owe him $400,000.
Senator Greg Tarver, you and I go back a long way. You sound angry about this today. Is that how you're feeling?
I am not so angry. I'm past that because they're sitting up here playing games with the health of the people of the city of Shreveport.
So what?
And you know why? They do not care. They do not have the sensitivity to deal with these poor people, the people who deal with the safety net.
So what is Senator Greg Tarver's solution?
My solution is bringing someone else with some experiences in running a hospital and spend the money wisely. And don't throw the money away on advertisement like they're doing on other things. I was reading something the other day. They're giving free shots to a wealthy area.
How soon could we realistically have another nonprofit in running the med school?
1 day.
Are you serious?
1 day.
And that's what Greg Tarver's for as we speak today.
I am for anyone who's coming in, even if it's Biomed, if they sit up and say, hey, we're going to do better. We're going to do this better. We're going to do that better. I'm for anyone that can deliver good health care service to the people of the city of Shreveport. Do not look at them as being poor people. Look at them as being people who also pay taxes, and they deserve the best medical care.
When can you tell us what that other entity is? When will you be able to divulge that?
Well, let me say this to you. It's not completely together yet. Whenever Biomed whenever they decide, and that's what they're trying to do, playing politics with the governor, whenever they decide to come forward, you know within 24 hours once they decide not to.